Hello, I would like to talk about recovery from labiaplasty. A lot of my patients have questions or concerns about this, and at the time of consultation, I go over this with them. So, first of all, a reduction labiaplasty is reduction of the labia minora, which is basically very superficial tissue. And as a result, it heals very well and is not too traumatic to the body. So one of the things is, I just want to give an overview about this, is that all these patients I give pre and post-operative instructions. So it's pretty explicit as to what has to be done. The patients during the procedure are injected with lidocaine, which is a type of numbing medicine. So for hours after the surgery, the area is numb. And that gives them plenty of time to get home. And one of the first things I recommend, and since it's superficial surgery, is that ice works very effectively. So they have a towel first, and then they put ice on top of that area. And it really is very soothing and reduces the pain and certainly reduces the inflammation. We all know that ice is helpful for reducing inflammation. And this can be done for the first 24 to 48 hours. Another thing that can be done the next day is the patients can take what's called a sitz bath. And a sitz bath is you fill the bathtub with a little bit of water, just enough to sit in, and it's very soothing to that area. The vulva or the labia, that area is used to a lot of bacteria. It's not like, say, the skin, the back of our hand, which is not used to bacteria. This tissue is, and as a result, it very rarely is there an infection. I give patients 24 hours of antibiotics. But other than that, really just soaking in a tub, this so-called sitz bath, is very soothing and there's very minimal chance of having an infection. And it's interesting, after childbirth, often the obstetricians recommend the next day the women have a sitz bath and rinse off that area. So obviously that's much more involved than having a labiaplasty. Okay, another big question that comes up, what about urine? Well, fortunately, urine is sterile. There's no bacteria in urine. So you can just simply urinate, and if there's anything there, you can just rinse it off with some water and you'll be fine, but you're not at risk for an infection. So just want to clarify that. Also, when can someone return to work? And although this is somewhat anecdotal, I would say the answer in almost all the cases is a few days. And some examples would be, I've had patients that were a waitress, for instance, and 3 days later, she was carrying trays around and she was able to do it. Another patient was in the middle of final exams, and I was able to do the procedure, and she did well and studied and took her exams, and she was able to do that. So I would say comfortably, if someone did this on, say, a Thursday, Monday, they could comfortably return to work. Post-operatively, I have different pain medications that I can give the patients, and they're often with that. And I think there's a quick recovery. In terms of returning to the gym, I would say that answer is probably somewhere between week 3 and 4, because you don't want to stir up extra inflammation. The first week, you're more than likely would have some bleeding. The area has an excellent blood supply, which is good in the sense that it heals very well. The bad news is that if you do a lot of activity in the first week, say go to the gym, you could be some bleeding. Last point is, of course, a woman can have intercourse. Before that, I would not recommend it. It's going to be too uncomfortable, and the chances of having dehiscence of the suture line are very high. Furthermore, no use of tampons for the first 4 weeks. Just the census for my patients is that they were able to have intercourse in 4 weeks, and at 6 weeks, it seemed like that was sort of the perfect timing where it was less sensitive, comfortable. And I would say there's a 99.99% happiness with this operation, and the recovery is very straightforward as I outlined. If you have any questions or concerns, feel free to make an appointment with me. Thank you very much.